Well, she has a radial pulse, so she must have a blood pressure of at least, what? You think you know? We'll find out on this episode of One for the Road. If you've grown up in EMS through the era of excellent trauma education and certifications like pre-hospital trauma life support or advanced trauma life support, you've likely encountered the popular teaching that a femoral pulse is indicative of a systolic pressure between 60 and 70. A carotid pulse is only possible with a blood pressure between 70 and 80, and a radial pulse means the blood pressure is above 80 systolic. However, these types of checkbox rules, often they don't stand up to research scrutiny. And this happens to be one of those. You see, patients come in all shapes and sizes. They can have vascular issues and dramatic differences in their adipose tissue and vascular elasticity. It doesn't stand to reason that we would feel the pulse in every human at exactly the same pressures, right? The truth of the matter is that some folks lose their radial pulse at a pressure of 80 systolic, and some will have a palpable pulse for a considerable time afterwards. In fact, some patients maintained a radial pulse with a blood pressure in the 50s systolic. The research also indicates that it's more typical to lose the femoral pulse while the carotid pulse is still present. So what are we to do? Does the presence of a radial or a femoral pulse mean anything to us? It certainly does. For sure, having a radial pulse is better than not having a radial pulse. And as blood pressure drops, the pulse will disappear. Typically, first the radial, then the femoral, and then the carotid. So feeling one and not feeling the other does have some clinical value to it. But you know what? When we recognize shock states, we need to do so by looking at the entire clinical picture, including the pulse rate, the skin signs, the level of consciousness, and perhaps even taking a blood pressure when time permits. Hopefully, when we recognize and treat hypovolemic shock, we don't need to wait for a radial pulse to disappear before we start treating the patient appropriately. The presence or absence of a radial pulse is certainly a valuable clinical finding, but don't proceed with confidence that the patient's systolic pressure is above 80 just because you can feel a radial pulse. I hope you find that helpful in your trauma care. I appreciate your time. I'm Steve Whitehead, and that is One for the Road.